Two people can be the exact same age, eat the exact same diet, and one of them feels sharp, strong, and energetic, while the other is exhausted by noon, struggling with joint pain, and wondering why their body feels like it belongs to someone 20 years older. The difference has almost nothing to do with willpower or genetics. It comes down to what is happening inside their cells at a level most doctors never discuss with their patients. By your mid-60s, you have already lost between 30 and 40% of your mitochondrial function. These are the tiny power-generating structures inside every cell of your body. And when they decline, everything declines with them. Your energy, your memory, your metabolism, your ability to control inflammation. But what the latest research has confirmed, and what almost nobody in mainstream medicine is telling patients, is that 4 specific foods available at any grocery store can actually trigger your body to grow brand new mitochondria, quiet chronic inflammation at its source, and produce changes you can feel within weeks. Stay with me through this entire video, because by the end, Dr. Queen is going to give you the exact doses, the exact timing, and the one preparation mistake that destroys most of the benefit before it ever reaches your cells. Dr. Queen has spent years watching the same frustrating pattern repeat itself in her senior healthcare practice. Patients come in exhausted, inflamed, foggy, and they have been told this is simply what aging feels like. They have been prescribed medications to manage the symptoms. Nobody has ever explained to them what is actually causing those symptoms at the cellular level. Nobody has told them that specific foods can address that cause directly. Dr. Queen is a senior healthcare specialist who has dedicated her career to understanding how nutrition and cellular biology intersect in adults over 60. She is sharing this because the research on mitochondrial regeneration through food is no longer preliminary. It is being confirmed in human clinical trials with biopsy-level evidence. And the people who need this information most are the ones least likely to hear it from their regular physician. Before we go any further, I want to know something specific, and your answer genuinely matters. When you feel that afternoon energy crash, that heaviness and slowness that hits around 2 or 3 in the afternoon, have you always assumed that was just normal aging? Tell me in the comments right now, because that specific symptom is one of the clearest signals of mitochondrial decline, and most people have been living with it for years without knowing what it actually means. Here is what is happening inside your body right now, and why this matters more urgently after 60 than at any other point in your life. Your mitochondria are not just energy producers. Think of them as the power grid for your entire body. When they are healthy and abundant, your cells have the energy they need to repair tissue, regulate immune responses, clear out cellular waste, and keep inflammation in check. When mitochondria become damaged and dysfunctional, they do not simply go quiet. They begin leaking, releasing fragments that your immune system reads as a threat. Your body mounts an inflammatory response. And because the damage is ongoing and accumulating, that inflammatory response never fully resolves. It becomes the chronic, low-grade inflammation that drives heart disease, insulin resistance, cognitive decline, and joint deterioration. Here's the part that changes everything. After age 60, your body's ability to clear out damaged mitochondria slows significantly. The cellular recycling process responsible for removing dysfunctional mitochondria, called mitophagy, becomes less efficient with age. Damaged mitochondria accumulate. The inflammatory signal they generate intensifies, and the biological environment inside your cells becomes increasingly hostile to repair and regeneration. What the research has now confirmed is that 3 specific biological pathways can reverse this process. The first is PGC1 alpha activation, the master switch that orders your cells to build brand new mitochondria. The second is AMPK activation, your cell's internal energy sensor that triggers biogenesis when it detects the right signals. The third is mitophagy acceleration, clearing out the damaged mitochondria that are generating inflammation so healthy new ones can take their place. The 4 foods Dr. Queen is about to share with you activate all 3 of these pathways through specific compounds that human clinical trials have now measured directly, not in theory, not in animal models, in biopsies of human muscle tissue. Here are the 4 foods that can regrow your mitochondria and stop inflammation at its source. Dr. Queen is going to give you each one with the exact dose and the critical preparation rule, because getting the preparation wrong does not slightly reduce the benefit. It can eliminate most of it entirely. The first food is pomegranate. Most people think of pomegranate as a pleasant fruit with a strong flavor. What it actually contains is a class of compounds called L-glutathione, and when those compounds reach your gut, your microbiome converts them into a molecule called urolithin A. Urolithin A is one of the most remarkable compounds identified in aging research in the last decade. It is the only naturally occurring food compound that has been shown in human clinical trials to simultaneously activate mitophagy, clearing out damaged mitochondria, and trigger biogenesis, the growth of new healthy ones. You are not patching old damaged machinery. You are demolishing it and replacing it. Pause. A research team at the Swiss Federal Institute of Technology gave older adults either urolithin A or a placebo for 4 months. The urolithin A group showed significant improvements in mitochondrial function, walked measurably further on a standardized endurance test, and demonstrated better grip strength. When researchers analyzed their mitochondrial markers, they resembled those of people a decade younger. That was not a subjective finding. It was confirmed with biopsies. The dose is half of a fresh pomegranate daily, or 4 ounces of pure pomegranate juice, 100% pomegranate, no added sugar, no blends. Drink it before bed. Your gut bacteria do the L-glutathione conversion overnight while you sleep. So urolithin A is circulating and active during your body's primary repair window. If you use a supplement, look for pomegranate extract, standardized to at least 30% punicolagens, taken with a meal that contains some fat. Norma Castillo, a 68-year-old retired physical therapist from Phoenix, Arizona, had been dealing with persistent fatigue and joint stiffness for 3 years. She told Dr. Queen she had simply accepted it as the price of getting older. Dr. Queen introduced the 4-food protocol, starting with pomegranate juice before bed each night. Within 3 weeks, Norma noticed her morning stiffness had reduced noticeably. By week 8, her afternoon energy crash, which had been a daily occurrence for years, had almost completely disappeared. I spent 30 years helping other people recover from pain and fatigue. I never thought I was the one who needed to hear this. The second food is dark chocolate, specifically 70% cacao or higher, 30 grams daily, which is roughly 2 small squares. The active compound is epicatechin, a flavanol that is one of the most potent natural activators of PGC1 alpha ever identified. When epicatechin enters your bloodstream, it activates both the master biogenesis switch and the AMPK energy sensor simultaneously, triggering your cells to begin building new mitochondria through 2 separate pathways at once. Researchers at the University of California, San Diego gave adults with established heart failure either epicatechin extract or a placebo daily for 3 months. At the end of the study, they performed skeletal muscle biopsies and measured mitochondrial volume directly. The epicatechin group showed a 41% increase in mitochondrial volume. Their exercise capacity improved measurably. Their cardiac function markers improved. That is a result that competes with pharmaceutical interventions from a food compound. Dark chocolate flavanols also block the NF-kappa B inflammatory pathway, the specific signaling cascade that drives production of inflammatory proteins like IL-6 and TNF-alpha. Studies measuring C-reactive protein in people who consumed high flavanol dark chocolate for 8 weeks showed inflammatory markers drop by 25 to 35%. Here is the preparation rule that most people get wrong. The chocolate must be non-alkalized. Turn the package over and read the ingredients. If it says processed with alkali or Dutch process, the alkalizing procedure destroys up to 90% of the flavanols. You are essentially eating flavored sugar with none of the active compounds. Look for chocolate that specifically says non-alkalized or non-Dutched. Eat your 2 squares in the afternoon. Your body's overnight repair systems benefit from the flavanols already circulating before sleep. The third food is fatty fish, salmon, mackerel, sardines, or anchovies, 3 to 4 4-ounce servings per week. The omega-3 fatty acids EPA and DHA from marine sources do something that no other dietary compound does quite the same way. They are physically incorporated into mitochondrial membranes. A healthy mitochondrial membrane needs to be fluid and flexible to function efficiently, to allow the electron transport chain that generates ATP to work at full capacity. As cells age, mitochondrial membranes become rigid and dysfunctional. EPA and DHA restore that membrane fluidity at the most fundamental structural level, improving mitochondrial efficiency from the inside out. Omega-3s also suppress the NF-kappa B inflammatory pathway directly. A study from the University of São Paulo followed 60 adults over the age of 60 who added 3 servings of fatty fish per week for 12 weeks. Mitochondrial enzyme activity in their muscle cells increased by 31%. Their muscle strength improved by 14%. Their endurance improved by 23%. These were people over 60 with no other major dietary change, just fish 3 times a week. The preparation rule here is critical. Do not fry your fish in vegetable oil. The omega-6 fats in vegetable oil oxidize at high heat and compete directly with the anti-inflammatory omega-3s you are trying to deliver. The two cancel each other out. Bake, broil, poach, or pan-sear in olive oil on lower heat. Canned sardines in water or olive oil are an excellent practical option, affordable, convenient, and extremely high in EPA and DHA. Theodore Marsh, a 72-year-old retired electrical engineer from Raleigh, North Carolina, had been managing chronic knee inflammation for 5 years. He had tried 2 different anti-inflammatory medications, both of which caused digestive problems he found intolerable. When Dr. Queen introduced the full protocol, Theodore was skeptical but methodical. He tracked his pain level on a daily scale. By week 6 of eating salmon or sardines 3 times per week alongside the other 3 foods, his daily pain score had dropped from an average of 6 out of 10 to 3 out of 10. His rheumatologist reduced his medication for the first time in 4 years. I was an engineer. I needed to see the data before I believed it. The data showed up. Now, before the 4th food, Dr. Queen needs to flag something that the majority of people get completely wrong. And it is a mistake so common and so easy to make without realizing it, that it silently eliminates a significant portion of the benefit from everything you have just heard. Do not turn this off. The 4th food is leafy greens and beets. 2 cups of raw spinach or arugula daily, or 1 medium beet 4 times per week. The active compounds here are dietary nitrates. Spinach, arugula, Swiss chard, kale, and beets are among the richest nitrate sources in the human diet. When you eat these vegetables, bacteria in your mouth begin converting nitrates to nitrites. In your stomach, nitrites become nitric oxide, and nitric oxide is one of the most powerful direct activators of PGC1 alpha in the human body. The same master switch that epicatechin activates through one pathway, nitric oxide activates through a completely separate and complementary pathway. Together, they are significantly more powerful than either alone. Researchers at the Karolinska Institute in Sweden gave healthy adults high nitrate spinach extract equivalent to 3 cups of fresh spinach daily for just 3 days. 3 days. Muscle biopsies showed upregulation of the proteins involved in mitochondrial biogenesis. Participants used measurably less oxygen to perform the same physical work, a direct sign that their mitochondria were already becoming more efficient. Nitric oxide also activates a pathway called NRF2, your body's master antioxidant program. When NRF2 activates, it switches on over 200 genes that produce your body's own antioxidant enzymes. These are the enzymes that neutralize the reactive oxygen species that damage mitochondria leak, the very source of the chronic inflammatory signal. This is not managing inflammation from the outside. This is eliminating the source of it from within the cell. Here is the preparation mistake that eliminates most of this benefit, and almost nobody knows about it. Do not use antibacterial mouthwash before eating leafy greens. The bacteria in your mouth perform the essential first step of nitrate conversion. Antibacterial mouthwash wipes out those bacteria and reduces your nitric oxide production from these foods by up to 60%. You eat the spinach, you get almost none of the mitochondrial benefit, and you never know why. The other preparation rule: do not boil spinach and throw away the water. Nitrates are water-soluble. If you cook spinach in liquid, keep the broth. That is where a significant portion of the active compounds have gone. If this information should reach someone who is suffering from fatigue and inflammation and has never heard any of this, please hit the like button right now. 1 second from you puts this in front of the people who need it most. Here is the complete protocol from Dr. Queen, and the timing matters as much as the foods themselves. Eat your leafy greens with lunch or as part of an afternoon meal. Your body's nitric oxide production peaks in the hours after consumption, and having that nitric oxide circulating in the late afternoon supports the cellular repair that accelerates during evening hours. Pair your spinach or arugula with your 2 squares of dark chocolate as an afternoon combination. Epicatechin and nitrates activate mitochondrial biogenesis through different but overlapping pathways simultaneously, and consuming them together produces a synergistic effect that neither achieves alone. Eat your fatty fish at lunch or dinner earlier in the evening rather than late at night. Your body needs to process the EPA and DHA during the active metabolic hours of the day, not while trying to wind down for sleep. Drink your 4 ounces of pure pomegranate juice 30 minutes before bed. Your gut microbiome converts the elagitannins to urolithin A overnight, and urolithin A's mitophagy activation works most powerfully during the deep repair cycles of sleep. In 3 days, most people notice their afternoon energy feels more stable and sustained. The 2 to 3 o'clock crash begins to soften. In 1 week, many people report that their thinking feels cleaner and their morning recovery feels faster. In 1 month, the anti-inflammatory effects begin to compound. Joint discomfort reduces progressively, and physical stamina during everyday activities improves in ways that become difficult to ignore. The one mistake Dr. Queen sees most often: people follow the protocol for 4 or 5 days, notice a small improvement, and then inconsistency creeps in. They miss a few days, they start again. They wonder why the results are not building. Mitochondrial biogenesis is cumulative. It requires a sustained biological signal over weeks. The measurable changes in mitochondrial density typically appear around week 4 of daily consistency. By week 12, the effects are pronounced. Treat this protocol the way you treat a medication you know you cannot afford to skip, because the biology works exactly the same way. The last patient worth telling you about is Franklin O.C., a 74-year-old retired federal judge from Minneapolis, Minnesota. Franklin was methodical, skeptical, and had been told by 3 separate physicians that his fatigue, cognitive slowness, and persistent inflammation were simply what his age looked like. He told Dr. Queen he would follow the protocol precisely for 60 days and then decide whether the science matched the claims. He ate pomegranate juice before bed every night, 2 squares of non-alkalized dark chocolate every afternoon, salmon or sardines 3 times per week, 2 cups of spinach or arugula daily, no deviations for 60 days. At his 60-day follow-up, his C-reactive protein, the primary blood marker of systemic inflammation, had dropped by 38%. His energy self-assessment had moved from a consistent 3 out of 10 to a consistent 7. His wife told Dr. Queen he seemed like himself again for the first time in years. "I have presided over thousands of cases. I know the difference between compelling evidence and wishful thinking. This was compelling evidence." That was not luck. That was Franklin finally giving his mitochondria the precise biological inputs they had been waiting for all along.